Senator Fetterman's return to Capitol Hill today is sparking a national conversation around clinical depression and mental health awareness. Fetterman received inpatient care for 6 weeks at Walter Reed National Medical Center in Bethesda, Maryland. Dr. Raymond Depaulo is a psychiatrist and professor at Johns Hopkins University. He's also the author of the book, Understanding Depression, What We Know and What You Can Do About It. Doctor, it's so good to have you here. I know that Senator Fetterman read your book while he was getting treatment. Depression is the most common mental health disorder in the U.S. It's on the rise. Nearly 10% of Americans suffer from it. Why is it rising, or are we just better at diagnosing it?
Well, listen, I wrote that book quite a while ago, and it was on the rise then, slowly. Under COVID, it rose much faster, especially in adolescence. But there are a lot of reasons for that. We can't always explain them. The brain is still the most complicated machine on the planet. So that we recognize depression, we have empirical treatments that are quite effective, but we don't understand exactly how the brain produces it, but we know something about that.
Right.
Including with yeah.
We know that only half the patients diagnosed with depression describe feeling sad. Many say actually they're numb or have unrelenting anxiety. So sometimes you might not even recognize it.
Well, yes, I did say that actually as well, and it's true. It's my experience. I've seen an awful lot of patients with depression. But they might agree they're sad, but that wouldn't be how they would spontaneously describe their emotions, okay? Patients often will say, like you say, they may describe having no emotions. More commonly, they describe themselves as feeling anxious all the time, but sad, hopeless, feeling, by the way, unworthy are very, very common and central feelings that come to people with depression.
30% of people who suffer a stroke go on to suffer depression. It's related to the lesions on the brain caused by the stroke. Do those lesions heal?
Yeah, well, the two things. One is that, yes, anybody that has a stroke in a particular part of the brain is more vulnerable to depression following the stroke. Like with any other stroke event, there is a recovery process, and we measure the recovery process usually by functional recovery, which is what we really mostly care about, okay? So, Senator Fetterman, I believe, and again, I've never met him, I haven't talked to him. I do want to thank him for reading and dog-earing my book, because it got me this interview, right? But at the same time, his language sounds already to me quite a lot better than it did shortly after his stroke.
I did want to ask you, Doctor, Senator Fetterman received extraordinary medical care, inpatient treatment for 44 days. Only 3% of Pennsylvanians who were hospitalized for depression in 2021 stayed longer than 30 days. Most just stayed 10 days on average. Fetterman's own staff put out this statement saying it shouldn't be something only a senator gets. It shouldn't be a luxury. It should be the norm, and that's what he's going to fight for. Why don't more people get more in-depth in-treatment care?
Well, first off, let me just say I couldn't agree more thoroughly with that statement. And I think that, look, the main reason people don't stay in psychiatric hospitals very long these days is because it's very high cost, and the hospitals lose money on it, okay? In the state of Maryland, when I reviewed all the hospitals under the control, Maryland's the only state in the union that sets hospital rates. The only places that, quote unquote, broke even in their psychiatric inpatient units were the ones who kept patients 2.5 days. So wow. Keeping patients longer means we really are trying to treat the patients. In most places, the hospital staff will tell you that they're only keeping patients long enough to, quote, stabilize them and get them into outpatient care. So hospital care is expensive, but it's very necessary.
Dr. Raymond Depaulo, it's a conversation I'm sure will continue. Thanks so much for joining us tonight with your expertise. Good to talk to you.
Thanks.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.